thoughts, pathological relationships. Are you into it? Relationships can be of different types. They can be healthy or pathological. Today we'll take a look at a few of the pathological relationships. First pathological relationship is that of a narcissist and a dependent. The narcissist is grandiose, self-idealized. The dependent suffers from an extreme inferiority, self-de-idealized. And the dependent seeks a narcissist and live through him. And a narcissist wants a dependent on whom he can lord over. So that's a pathological relationship, very compatible, but the compatibility is rooted in pathology. It's a pathological compatibility. Quite possible that both of them independently cannot heal themselves and cannot live with any other personality, and so they come back to it, quite possible. But essentially it remains a pathological relationship. Similarly, a paranoid and a manic. The paranoid is terrified of attacks, and the manic in his grandiosity comes out as the savior, as the brave savior. The sadist and the masochist. The sadist needs a masochist to beat up, and the masochist needs a sadist to beat him up. All the three are pathological relationships. And one has to honestly look at oneself and those we are related to see if any of this is at work. And if it is, it calls for very sincere and deep work on oneself. And often it can also demand that we run for our life away from the pathological other. Fourth pathological relationship can be a therapy stalwart. Where things are just not moving because neither of the two is ready to access very difficult parts of oneself or the other, and there is a stalemate in therapy. It's a kind of a pathological relationship in the therapy setting. It's an unconscious collusion. Fifth, termination of therapy because a pathological relationship could not be managed. So often it can also lead to termination of therapy. It may be projection of Oedipus, it may be projection of the paranoid schizoid split. Whatever be the reason, somehow it could not be interpreted, managed, or handled in therapy, or talked about in therapy, or talked effectively about, and results in the termination of therapy. Sixth is a therapy relationship where certain things just don't come up in therapy. So it does not result in stalemate or termination. It's just that the therapy ends without having touched upon certain things. And after therapy ends, one realizes that how come in so many years this just never came up. And there again, there is an unconscious collusion, a pathological relationship, at least in some sector of the total relationship. The whole relationship may not be pathological, but in some sector, there is a pathological relationship, a part pathological relationship. Seventh can be what has always been reenacted in real life is reenacted in the therapy again, and one is not able to work through. And this is one more of a chain of similar experiences driven by the same templates. And The reenactment either cannot be managed and results in termination, or it may remain frozen. It may be kept aside without being taken up. So that creates a very strange kind of situation. So there are two situations here: a reenactment without getting resolved, and second, a reenactment which is stopped midway, does not reach the conclusion like it does before, but is kept frozen there and kept in a corner so that one does not have to deal with it. All these seven are instances of pathological relationships in everyday life or in therapy. Thank you.